Hey everybody, Adam Menzel, Certified Advanced Rolfer, coming to you again with another video to help you find ease and balance in your body during this time. This one's called Happy Hips, and it's a result of a number of requests from clients for things we can do at home to feel better in the hip area. This is a partner exercise, so you'll need someone to work with. It takes about 5 to 8 minutes, should have you feeling much more at ease and balanced around the hip area. Let me know what you think about it. Share this openly, and if you have any requests for future videos, please send them my way and I'll do my best to get that content out to you as soon as I can. In the meantime, please visit me at Get Rolfing with Adam Menzel on YouTube or on Facebook at Get Rolfing. I hope to see you back in my office soon. Look for updates on the reopening of my practice. I will send those to you as soon as things become clear as we move forward. This video is called Happy Hips. The goal is opening the area around what we call the greater trochanter, which is this bony area that we feel on the outside of our hip. It's actually part of the femur. The hip joint is actually more inside here. So the first thing you're going to do is locate this bony area right around the side of the hip. And we're going to work kind of in a 360-degree kind of arc or circle, I should say, around that. All right. A couple things to keep in mind. You see the way Alaya's positioned here. She's got her knees bent, we got a pillow in here for support, and she's lying directly on her side. It's best if you do this on like a carpeted floor would be good. You could do it on a kind of a more firm bed. I wouldn't do it on something that's soft like a couch or a real soft bed. But the important pieces here is that you can kind of have the person kind of supported in this side-lying position like this. And then what we're going to do is we're going to find that bony area there, that greater trochanter of the femur, and we're going to use a soft fist like this. And we're going to work first right above it, where we're going to locate gluteus medius and gluteus minimus. And I'm going to use just gentle downward pressure, allowing for time to do the work, not a lot of force, not a lot of moving back and forth, just kind of gentle sinking like that. How we doing, Alaya?
Good.
Okay, and then repositioning, now coming a little bit more anterior or a little more forward. And same kind of thing, just waiting for a sense of softening or easing of the tissue. And so that's one tool you can use, a soft fist. Not like this, but just a nice soft fist supported like that. Probably a more effective way that takes a little getting used to, but it's using the blade of the ulna, or the kind of side of the forearm. Not the pointy part, but this kind of blade-like part. And that you can actually cover a lot more area. And just, again, gently sinking in, allowing your body weight to settle in. And how are we doing with that? Okay. So this allows me to contact a larger area. And again, just waiting for a sense of softening and easing of the tissue. And then repositioning to kind of come around more towards the posterior part. This is where we'll encounter gluteus maximus and starting to connect into the deep rotator muscles, piriformis being one of those that you may have heard of. And again, just using pressure down and time just to allow for some softening and easing there. Okay, I'm going to come around and use a little different angle to get the more posterior part of that same area. Okay, how are we doing there? Okay, here's kind of a more bird's eye view here. This is the area that I described as the kind of bony greater trochanter. And these are the areas you're gonna wanna work. So I'll show you here with this soft fist again. Just kind of seeing this from above, just above there. And then just kind of working around more posteriorly. And then this is what it looks like with this broader tool of the forearm. And introducing just a little bit of movement, either passively or with the client's help, just mobilizing the hip a little bit. So the goal is to open up about 10 myofascial structures here around the anterior, superior, and kind of posterior part of the hip. Using nice, easy, yet direct pressure. Another thing you can do is have the client do a slow extension at the hip as you're working. And this often increases the kind of spiciness of this movement, and then slowly come back up. Good, and then let that go. Great. How are we doing with the intensity? A little more there.
When I moved it, yeah.
Okay. Now, keeping in mind that a number of these structures up here attach to the iliotibial band, or the IT band, that gets so much attention. So many of us are kind of trying to stretch or to elongate the IT band with the foam roller, when in actuality, a lot of the tension, so to speak, that ends up in the iliotibial band actually comes from some of the structures up here. So by working in this area, we actually can kind of unload this IT band, and that saves us from having to roll it out all the time, which is not really an effective way of releasing the tension of the IT band. So if you have any comments on the video, please share them. Please, by all means, share this video openly with whoever you think it might be useful for. And if you have any requests for future videos, I sure would like to hear that. I'll be sending some updates on the reopening of my practice really soon, and I hope to see you in this space in the next, well, couple weeks or so.